All right, let's jump into another deep dive. Today, we're going to be looking at AI in healthcare,
Mm,
specifically how it's already being used to, diagnose and treat a bunch of different conditions.
sounds pretty futuristic.
It does, right? But the thing is, it's not as futuristic as you might think.
Yeah.
We're going to be using a recent article from WebMD as our guide for this little journey.
Oh, WebMD, I know them. They're pretty reliable.
Exactly. So we know we're dealing with good information here.
Great. I think what's interesting is that this isn't just some far off thing.
Right.
AI is already having a real impact on healthcare right now.
Yeah, and I think people get this idea that it's all about robots performing surgery or something.
Yeah, for sure.
But a lot of the AI we're talking about is kind of behind the scenes.
Helping doctors do their jobs even better.
Yeah, exactly. Think about how your phone can suggest a quicker route because of traffic,
Right.
or how your streaming service recommends shows you might
I mean, yeah, that's happening all the time.
That's AI at work. And that same technology is now being applied to healthcare.
In some pretty awesome ways.
For sure. So let's get specific. The WebMD article starts off with this condition called diabetic retinopathy.
Oh.
And for those who don't know, it's a complication of diabetes.
Right.
And it can actually lead to vision loss. Pretty serious stuff.
Oh, wow. Yeah, that's definitely something you want to catch early.
Absolutely. And that's where AI comes in. So there's this software, it's called IDXDR, and it can actually detect signs of this condition, years before any visible symptoms even show up.
Well, hold on. So you're saying it can catch something before you even know something's wrong.
Pretty much. That's the power of this technology.
That's amazing.
Yeah.
So early detection basically means you can actually save your sight.
Exactly. It's like having almost like a super eye doctor in a computer program.
Right. Constantly looking for those tiny little clues.
Yep. And speaking of speed being crucial, the article also talks about how AI is being used to tackle stroke.
Oh, stroke is, I mean, that's one where every second really does count.
For real, the faster you get diagnosed and treated, the better the outcome is going to be.
Definitely.
And that's where this algorithm called Viz.ai Contact comes in.
Okay, what's that do?
Well, it analyzes CT scans for signs of a stroke
Okay.
and then immediately alerts specialists, right away.
So we're not even just talking about improving the diagnosis at this point.
Right.
AI could actually be the difference between life or death for some of these stroke patients.
Yeah, it's that serious.
Wow. And the article mentions that AI is also being used to fight heart disease.
Yeah, and we all know heart disease is the leading cause of death in the U.S.
Definitely a big one.
So any help we can get there is pretty important.
Okay, so how's AI being used there? I think I saw something about echocardiograms and EKGs.
Yeah, so echocardiograms, those are basically ultrasounds of the heart.
Right, right.
And there's this AI software called Caption Guidance that helps create really high-quality ultrasound images, which is super helpful, especially for medical professionals who, maybe they're not experts in reading those images.
So AI is kind of like lending a hand there.
Exactly, making sure those images are, as clear and as accurate as possible.
That makes sense.
And then there's EKGs. Those measure your heart's electrical activity.
Yeah, I've had those before.
So get this. AI-powered EKGs can actually detect irregular heart rhythms,
Like what?
like atrial fibrillation. And they can do it before you even experience any symptoms.
Oh, wow. So it's like predicting potential problems.
Yeah, it's kind of wild, right? And the article even talks about AI-powered portable EKG devices and even smartphone apps.
Oh, so you can analyze your own heart rhythm.
It makes you think, though, how much can we rely on those without a doctor's input?
That's a good question. It sounds super cool and convenient.
For sure.
But I guess they can't replace a doctor's diagnosis, right?
Yeah, exactly. That's what the article emphasizes. They're more like tools that provide, you know, extra information.
It
Always
is.
best to use them with your doctor, you know?
Absolutely.
Yeah.
So AI is more like a really helpful assistant for your doctor.
Mhm. Yeah, not a replacement.
Okay, let's see. What else? Colon cancer.
Oh, yeah. Another big one. And AI is playing a part in detecting that too.
Early detection is key with cancer.
Definitely. So there's this AI-assisted device. It's called GI Genius.
Okay.
And it's used during colonoscopies. It's like almost like a second pair of eyes for the doctor.
Nice.
It scans for any suspicious growths or polyps that might be missed.
So it's like a super attentive spotter, right?
Yeah.
Making sure nothing gets overlooked.
Exactly. But it doesn't replace biopsies or anything like that.
Gotcha.
AI is a tool to assist doctors, not replace them, right?
Makes sense.
So GI Genius helps doctors focus on the areas that need a closer look, but biopsies are still needed to confirm the diagnosis.
Right, right. So AI is all about improving accuracy and like catching things early.
Exactly. And it's not just colon cancer. The article also talks about prostate cancer.
Okay.
They have this AI software called Page Prostate.
Mm.
And what it does is it analyzes biopsy images,
Yeah.
and it helps pathologists, the doctors who examine tissues, identify potentially cancerous areas that maybe they missed.
So it's kind of like having like a extra set of highly trained eyes, like going over those biopsies.
Right. We're seeing a pattern here, right?
It seems like AI is all about like helping doctors make quicker and more accurate diagnoses.
Across a bunch of different conditions. It's pretty incredible.
It is.
And believe it or not, AI is even being used for something as common as wrist fractures.
Wait, really?
Yeah.
Like broken wrists.
Yep. Think about it. Wrist fractures happen all the time. People fall. Things happen.
Right.
And we use x-rays to diagnose them, but sometimes those fractures, especially in those tiny wrist bones, they can be hard to see.
Yeah, I can imagine.
So that's where this software called OsteoDetect comes in.
Okay.
It helps doctors identify those like really subtle wrist fractures on x-rays.
Oh, so it helps avoid misdiagnosis.
Exactly. And that way patients can get the right treatment right from the start.
So it's the same story, right? Quicker, more precise diagnosis.
Yep. And all thanks to AI.
This is pretty amazing. So what's next? Where else is AI going to show up in healthcare?
Well, the possibilities are like mind-blowing. Imagine AI-powered virtual assistants,
Oh,
giving personalized health advice, keeping track of your vital signs, reminding you to take your meds.
wow. That would be a game changer, especially for people with like chronic conditions, right?
For sure. No more forgetting to take pills or, missing appointments.
And what about like drug discovery? Could AI help with that?
Absolutely. Imagine AI analyzing all this data to identify patterns and risk factors.
That we don't even know about yet.
Yeah, it could lead to new cures and treatments for diseases that right now don't really have great options.
The future of healthcare with AI sounds pretty amazing, honestly.
It does, right. But let's not get too carried away.
Right.
It's easy to get caught up in all the amazing potential of AI in healthcare, but we have to remember it's a tool.
It's not a magic wand.
Exactly. We can't expect it to, solve every problem overnight.
Definitely not.
And it's super important that we use it responsibly and ethically.
Couldn't agree more.
Right. So AI should be seen as a way to empower healthcare professionals.
Not replace them.
Exactly. It's all about that human touch, the empathy, the critical thinking of doctors and nurses.
That'll always be essential.
Yeah, we need to make sure that AI is enhancing the patient experience, not dehumanizing it. You know what I mean?
Yeah, for sure. So it's about like finding that sweet spot between the technology and the human side of care.
Right, and figuring out how to navigate this whole evolving landscape.
And what about like the patients? What role do they play in all this?
Oh, that's a great question.
A big one.
And one that we are definitely going to delve into.
Okay, good.
After a quick break.
All right.
So stay tuned.
I will.
We'll be right back with more of our deep dive into the future of AI in healthcare.
It's really, it's pretty fascinating when you think about it.
What is?
The implications of AI,
Yeah.
for patients and for healthcare professionals.
Totally. I feel like we've barely scratched the surface of what AI can do in healthcare.
Yeah, we've talked about diagnosis and treatment,
Right.
but there's like a whole other area we haven't even touched on.
Which is preventative care.
Oh, that's a good point. I mean, we're all about catching things early,
Yeah.
but what if AI could help us avoid those issues in the first place?
That's exactly what I'm talking about. Imagine AI analyzing your lifestyle,
Okay.
your genetics, environmental factors
Uh-huh.
to identify potential health risks,
Before they even become a problem.
before they even become a problem.
That's wild, like having a personalized health crystal ball or something.
Right. Guiding you toward a healthier future. So instead of just reacting to illness, we could actually be proactive.
Exactly, and prevent it.
Okay, so prevention is huge, but what about managing chronic conditions?
Oh, yeah. So think about it.
Yeah.
AI-powered apps that
Yeah.
track your symptoms,
Okay.
medication adherence,
Mm-hmm.
even provide personalized coaching and support.
That would be amazing for like people with diabetes, heart disease, even mental health issues.
Absolutely. Better self-management, better quality of life.
Right.
And it would like reduce the strain on the healthcare system.
Yeah, that makes sense. We talked earlier about AI and drug discovery. Can you
Yeah.
maybe expand on that a little bit?
Sure. Developing new drugs is it's a long and complicated process,
Alright.
but AI can analyze like huge data sets of medical research, clinical trial data, even genetic information
Okay.
to find promising drug candidates much faster.
So AI could be the key to like new treatments for diseases that don't really have good options right now.
Exactly. It's a pretty exciting possibility.
It is. But I think with all this talk about the potential of AI,
Yeah.
it's important to address like the concerns people might have.
Of course. Some people are, worried that AI is going to replace doctors altogether.
Right, and that we're going to lose that human touch in healthcare.
It's a valid concern, but it's important to remember that AI is just a tool.
Right.
It's not a replacement for human judgment, human empathy.
It's about finding that balance, right?
Absolutely.
Using AI to help healthcare professionals, not replace them.
Right. Think of it as like a collaboration.
Okay.
AI can do the data analysis, the pattern recognition, all the risk assessment.
Mm.
And that gives doctors and nurses more time to focus on what they do best.
Which is,
Building relationships with patients, providing support, and making those really nuanced decisions.
the ones that need that human touch, that intuition.
Exactly.
So it's kind of like AI can take care of the administrative stuff
Right.
and let doctors actually spend more time with their patients.
Getting to understand their needs.
Yeah.
Their concerns.
It's like it's the best of both worlds in a way.
That's the goal, yeah.
This all sounds incredibly promising,
It is.
but I do have a question.
Yeah.
What about access? Will everyone be able to benefit from this?
That is the million-dollar question, right?
Right.
We need to make sure these technologies are available to everybody.
It shouldn't just be for, like, the wealthy or the privileged, right?
Absolutely.
Yeah.
Think about AI-powered diagnostic tools in remote areas.
Oh, yeah, where they might not have specialists.
Exactly.
Mm.
Or telehealth platforms that use AI for virtual consults.
That's a great example. And follow-up care.
It's about using AI to like break down barriers and make sure everyone has access to quality health care.
It's about health equity.
Exactly.
I like that.
That brings us to, I guess, another big topic,
Which is,
the ethical side of things.
oh, right, like with any powerful technology.
I got to be careful, right?
Yeah, we have to be really mindful of how AI is developed and used in healthcare.
One of the biggest concerns is data privacy,
Right, because AI needs all this data to work.
and we have to protect that patient data.
People need to know their information is safe and being used responsibly.
Absolutely. And then there's the issue of bias.
Oh, right.
AI algorithms are trained on data, and if that data is biased, the AI can actually amplify those biases.
So we have to be really careful about that.
Yeah, we have to make sure those AI algorithms are fair, equitable.
Right, and that they don't, like, make existing health disparities even worse.
That's a big one.
Ah.
We need to make sure AI is used responsibly and benefits everyone in society.
This has been a really interesting conversation.
It has.
I'm learning a lot.
Me too.
But I am curious, what does all this mean for us as individuals?
Oh, that's a great question. We'll get into that right after this.
Okay, sounds good. Okay, so we're back, and before the break, we were talking about what all this means for us,
Right, like what's our role as individuals in this whole new world of AI and healthcare?
Yeah, because it's easy to get, like, kind of overwhelmed by all this stuff.
For sure.
So where do we even start?
Well, I think the most important thing is to just, be informed,
Okay.
be engaged,
Uh-huh.
and start by just talking to your doctor.
Okay.
Ask them how AI is being used in their practice, what it means for you.
That's a good point. Just having those conversations can, like, really help.
Demystify it all.
Yeah, and empower you to, make those informed decisions about your own healthcare.
Exactly. And don't be afraid to ask questions. If you're
Okay.
using any of those AI health apps or devices,
Yeah.
just make sure you understand what they can and can't do.
Right, and remember, they're not a replacement for, like, actual medical advice.
For tools, not the final answer.
Exactly. It's about using them responsibly and always, in conjunction with guidance from your doctor.
Absolutely.
Oh.
And I think, beyond just us as patients,
Yeah.
it's also important to think about the bigger picture,
What do you mean?
like the societal implications of all this.
Huh. Oh, okay.
We need to make sure AI is being developed and used ethically.
Right, we talked about data privacy and bias.
Yeah, but there's even more to consider.
Like what?
Well, for example, how do we make sure AI benefits everyone?
Right, not just certain groups.
Exactly.
Yeah.
And how do we prevent it from, like, making those health disparities worse?
Those are big questions.
They are.
It sounds like we need to have a real conversation about all this as a society.
I think so, yeah.
Yeah.
We can start thinking about these things now.
So we can shape the future of AI in a way that's good for everyone.
Absolutely.
This deep dive has been, it's really been eye-opening.
I agree.
The potential of AI in healthcare is just, like, incredible.
It is.
But I also realize now that we have to be really careful, really thoughtful about how we move forward.
I think that's the key takeaway.
Okay, so as we wrap up here,
Yeah.
what's, like, the one thing you want our listener to remember about AI in healthcare?
I think it's this. AI is a tool,
Okay.
a powerful tool,
Yeah.
but still just a tool. The future of healthcare isn't about replacing humans with machines.
It's about finding that balance.
Right, the synergy between human expertise and this amazing technology.
That's a great way to put it. I like that. So AI can enhance our abilities.
Give us insights, help us provide better care.
More personalized care.
Exactly.
But in the end, healthcare is about people taking care of people.
It is. And that human connection, the empathy, the compassion,
Yeah.
that will always be at the heart of healing.
This has been such a great conversation, really exploring this whole world of AI in healthcare.
We've covered a lot of ground for sure.
From like specific examples to future possibilities, even ethical considerations.
It's a rapidly changing field.
It is.
So, keep learning, stay curious.
Absolutely. And who knows, maybe one of our listeners will be inspired to like actually work in this field.
You hope so.
The future of healthcare is it's in our hands, really.
It is.
And AI is a powerful tool that can help us create a healthier, more equitable world for everyone.
Here's to the future.
To the future. All right, that's it for this deep dive. Until next time, keep exploring, stay curious, and remember that the future of healthcare is full of possibilities.